Hello everyone, welcome back to the next video on the Be Healthy channel. In this video, I will bring you positive things to help people with HIV live healthy lives like normal people. Please watch. HIV is a lentivirus that causes HIV infection and acquired immunodeficiency syndrome. AIDS is a condition in humans in which progressive failure of the immune system allows life-threatening, opportunistic infections and cancers to thrive. Without treatment, average survival time after infection with HIV is estimated to be 9 to 11 years. Infection with HIV occurs by the transfer of blood, semen, vaginal fluid, pre-ejaculate, or breast milk. Within these bodily fluids, HIV is present as both free virus particles and virus within infected immune cells. But don't worry too much. Here are 5 ways to help people with HIV live healthy, prolonging their life like normal people. 1. Strict adherence to medication helps people with HIV stay healthy. The drugs, known as PrEP, will be available free of charge in the country of residence, in pill form and, for the first time, as an injection, and will help the immune system, restoring CD4 cells to increase again. The benefits of treatment include reducing the risk of opportunistic infections and deaths related to HIV. When pregnant women are treated early, HIV in the blood is suppressed to undetectable levels, reducing the risk of HIV transmission from mother to child during pregnancy, birth, and after birth. When treated with medication, people with HIV can live healthy lives, work like people without HIV, and confidently integrate into the community. Some studies show that people with HIV who are treated early and maintain good treatment have the same life expectancy as people without HIV. Therefore, strict adherence to medication is the most important issue in preventing drug resistance. At least, the compliance rate of HIV-infected people must be above 97%, generally not forgetting to take any medication for 1 month. HIV-infected people should set an alarm notification on their phone, keep the medication in a visible place, ask relatives to remind them if necessary. In case of business trips or travel, bring double the expected amount of medication in case of an unusual incident that leads to not bringing enough medication. 2. Practice a healthy lifestyle. A healthy lifestyle can improve a person's energy and mood, help them stick with treatment, and motivate them to manage any side effects of medication. Diet is of utmost importance and should be a priority. An anti-inflammatory diet rich in phytonutrients, vitamins and minerals, and high in protein can help fight infections, promote overall health, and boost immunity. Avoid eating raw food and undercooked meat. Do not smoke, do not drink alcohol, sleep at least 7 hours a day. Exercise not only brings good health to people with HIV, but also helps fight some side effects during treatment. With the habit of maintaining exercise at the right intensity, people with HIV can increase energy levels, help people with HIV feel less tired, stimulate appetite, thereby helping people with HIV eat better and gain weight, improve sleep quality. 3. Relieve anxiety and stress. Experts say that feeling ashamed about the disease makes people with HIV more anxious and stressed. This is also the reason why the disease becomes more serious. Therefore, people with HIV should think positively and encourage themselves to avoid anxiety, stress, depression, and despair that affect their health. People with HIV should not be too worried or depressed, but need to quickly overcome the initial shock and regain confidence in life to protect their own health. Only when maintaining an optimistic and happy spirit can people with HIV cherish their own bodies, eat and rest to ensure their health. People with HIV are very susceptible to feelings of inferiority and abandonment. This makes treatment difficult to achieve effectiveness, such as not eating, not taking medication, not cooperating with treatment. Therefore, people with HIV should share with relatives and friends to receive encouragement and care to avoid feelings of abandonment and inferiority. For HIV patients, the care and sharing of people who sympathize with and are in the same situation, relatives and friends, is the best medicine. It is necessary to actively exercise at least 20 to 30 minutes a day and play a suitable sport. Participate in social activities or participate in support groups, self-help clubs, or clubs of people in the same situation. Spend more time relaxing and resting. This will help the soul to be more relaxed and optimistic. 4. Have adequate knowledge about opportunistic infections. Opportunistic infections are specific infectious diseases that are common in people with weakened immune systems, especially those infected with HIV. Opportunistic infections can cause health problems when the immune system of people infected with HIV is weakened, even increasing the risk of death in people infected with HIV. Therefore, in order to live healthily with HIV, people infected with HIV need to have certain knowledge about the causes, consequences, and ways to cope with opportunistic infections. In addition, it is necessary to maintain the habit of regular medical checkups to promptly detect the disease, thereby having appropriate and effective treatment. People infected with HIV should not take medication without a doctor's prescription, must strictly follow the doctor's instructions to avoid possible dangerous consequences. Some common opportunistic infections include herpes simplex virus 1, causing ulcers on the lips and mouth; candida infection, a fungal infection of the mouth, bronchi, trachea, lungs, esophagus, or vagina; toxoplasmosis parasite infection, affects body parts such as the kidneys, brain, skin, lymph nodes, and eyes. 5. Herbs good for people with HIV. Aloe vera helps relieve constipation. Basil helps relieve nausea and aids digestion, has antiseptic properties for mouth ulcers. Marigold has anti-inflammatory and healing properties, helps treat upper gastrointestinal infections. Cinnamon, good for colds and weakness after a cold or flu. Also used for diarrhea and nausea, stimulates appetite, gently stimulates digestive juices, promotes bowel movements. Garlic has antibacterial, antiviral, and antifungal properties, especially in the intestines, large intestine, lungs, and vagina. Aids digestion, good for thrush, throat infections, herpes, and diarrhea. Ginger improves digestion, increases energy, relieves diarrhea, and stimulates appetite, used to treat common colds, flu, and nausea. Peppermint may help relieve nausea, relieve abdominal pain, stomach pain, and cramps, help control diarrhea, reduce stress and insomnia. Currently, the number of HIV-infected patients worldwide is decreasing, which is a positive thing in life. We have compiled effective methods, which have been consulted and recommended by medical experts, to increase health and longevity for HIV-infected patients. We always wish you happiness and peace in life with your family. If you find it meaningful, please share and spread the video to many people. We love you. See you again in the next video on our channel.